Major concerns about the spread of measles in the Chicago area. There are now 5 confirmed cases of the virus. And some of the patients are migrants who visited ERs and healthcare facilities in the city and suburbs. Joining us is Fox Medical contributor Dr. Mike Cirigliano. Dr. Mike, you're going to kind of help us break through and get some answers to some questions we have here. First of all, we know that we get the vaccine as children. When do kids finish their series of immunizations? And when are they effective?
Well, they get them at a young age, and by most accounts, it's good for life, Natalie. Now, the thing is, and what I've experienced over 30 years, is that there are times, now, for instance, if I have a kid going off to college, and for some reason I can't find their immunization records, I will do titers. I will see if they have immunity. And many times they will not have immunity, and then I just give them one booster. So when it comes to the general public, unless there's a compelling reason, we generally don't look into that. Now, again, that being said, sometimes we have to give a booster. When you are dealing with an outbreak or somebody that you don't have any kind of records on, like migrant workers or someone that you may have never gotten immunized, they will certainly then need to get the immunizations. But for everyone else, when it comes to measles, we generally feel that it's a lifelong immunization.
So maybe
it lasts a lifetime.
Lasts a lifetime. Maybe you just answered this next question, but I'm going to ask it anyway. We've heard that people who are immunized, I think we had a doctor on the other day saying they're about 94% protected if you are immunized. But if there is a surge in cases locally, does that make us more vulnerable?
Well, if you are immunosuppressed or you have coming, you know, this virus is very contagious. And in the outbreaks that we've had, like in Philadelphia or in New York, it's mainly people who have not had their kids vaccinated. And so that's the problem. And again, if you think about it, we have so many good tools to prevent outbreaks with immunizations. And lots of people are against vaccinations. It's a problem I deal with all the time. The bottom line is, look, if you're concerned, go to your healthcare provider. We can easily do titers for measles, mumps, and rubella. Okay. Now, you have to remember, it is an attenuated live virus, so you have to be aware of who can get it and who can't. But bottom line is, check with your healthcare provider. If you have an immune deficiency, you can get a booster. All
right. Dr. Mike, thank you. Let's switch gears now and talk about the hidden dangers in diet soda. We've known about the chemicals in diet pop for a long time now, but now there's research linking it to an irregular heartbeat. So how big is this link? Does it concern you?
Well, this was not a cause and effect type of study. It was kind of maybe an association, and so it needs more research. Look, we know for a fact that heavily sugar-laden drinks are not good for us. We know for a fact that that's not good. When it comes to the diet drinks, there's a lot of debate. Does it have effects on the microbiome in the intestines? Does it have an effect on inflammation? We don't know. What I believe in is what my grandfather said, and that is everything in moderation. Now, this study looked at drinking 2 liters of some of these types of drinks over a week. In my opinion, and I just want to show you what I have my kids doing, I have them doing naturally flavored carbonated water that has no artificial or sugar added, and it tastes good, and it's naturally flavored. And I've had my kids from day one, Natalie, get going with this kind of thing rather than, as you guys call it, pop, we call it soda. And so that's the way to go if you can do it.
Okay, Dr. Mike, thanks so much. Always good advice. Always good to see you. Have a great day.